morning. My name is Leslie Terjesen. I am the Public Information Officer at the Ocean County Health Department. We are the largest health department in the state of New Jersey, next to the New Jersey Department of Health and Senior Services. This week, the first week of April, is always celebrated. We celebrate National Public Health Week. Public Health Week is a great way to educate people on how to live healthier lives. This year's theme is a healthier America begins today. Join the movement. For Monday, they're focusing on active living and eating healthy. They want people to make better choices, eat more fruits and vegetables, become more physically active, and that's not just for children, that's also for adults. On Tuesday, living tobacco and drug-free and preventing alcohol abuse. We don't want to see people smoke. We don't want to see children start smoking because then we need to work with them to get them to quit smoking. So one of the best things we like is people to never pick up a cigarette, but if they are smoking, we want them to quit. Not only smoking, we know the dangers of secondhand smoke. We've managed to have the Clean Indoor Air Bill passed so people can't smoke inside buildings. We don't want them smoking by the door. We know the dangers of secondhand smoke. We know the dangers to children. We know that children are more at risk for asthma. Children are more at risk for sudden infant death syndrome if they're living in households with people that smoke also. Preventing alcohol abuse, we really want parents to be careful what's left in the house. We are very concerned about drugs being in the house. We want people to, if they have a lot of vials of pills, etc., when they have company, we want them put away where they're not handy for people, where children or youth or young adults can grab. We really are very, very concerned about the rates of prescription drug abuse, and we're looking for ways of proper disposal of prescription drugs. On Wednesday this year, we're talking about preventing communicable diseases. Again, wash your hands with soap and water. Cover your cough or cough in your sleeve. We tell people to cough like this. We walk through the mall and we see children doing that, so we're glad that we've gotten that message across. And stay home when you're sick. Do we promote hand sanitizers? Yes, I have a bottle somewhere on my desk right here. We do. Nothing takes the place of washing your hands with soap and water. We encourage people to do that when they have the opportunity to do that. But if they don't, I think, I carry hand sanitizer. Most people I know carry it. We have it at the health department if you need it. And also in preventing communicable diseases, we're also talking about foodborne diseases. We certainly discourage people from eating raw foods. There's a lot of bacteria and viruses that people can consume rather than toxic types of things in foods. We want people to make sure that there's no cross-contamination. If they're dealing with raw meats and cutting on a cutting board, and then they're going to cut a salad on that salad board, that everything needs to be washed with hot water and soap, including the cutting board, the knife, your hands, etc. We try to avoid that. And again, we certainly encourage immunizations. The best thing you can do is to be up to date, whether you're a child, an adolescent, or adult, to be up to date on your shots. We are now in the process of giving Tdap vaccines. That's tetanus, diphtheria, and pertussis. We know that the way children get whooping cough, the majority of children get it, is from an adult that has it. So we're encouraging people, even if they had a tetanus shot last year, they can get a Tdap vaccine. They can certainly call the health department about that also. On Thursday, practice safe and healthy reproductive and sexual health. We offer STD, sexually transmitted disease counseling at the health department every Wednesday night. We also offer HIV counseling and testing on Tuesday and Wednesday night. Because we saw that the majority of people coming to our sexually transmitted disease clinics were north of Lacey Township, we opened up our southern clinic on Haywood Road in Manahawkin, that every second and fourth Thursday we have sexually transmitted disease testing and counseling and education at our southern site. We test in our sexually transmitted disease clinics for syphilis, gonorrhea, and chlamydia. And we, not only do we test, but we treat for them also. We encourage parents to be approachable parents. We know that most knowledge, comes from not only on sexual health, but eating, physical activity. So much of it comes in our households. We certainly hope that parents can feel comfortable talking to their children about sexual matters, sexually transmitted diseases, and hopefully children can turn to their parents to talk to them with questions, concerns, because that's very, very important. And also schools are very good at letting kids know who they can turn to if they need to. And on Friday of this week, they're talking about promoting stable mental and emotional well-being. We get a lot of calls at the health department. People don't know where to go. They're in some type of mental crisis, and we refer them to the mental health board. We always make sure there's somebody at that other end of the phone that they can get to. We don't like to just say, well, you called the wrong place, here's a number. So we like to make sure that people can get a hold of somebody, or we'll make that call and ask the person at the other end to call the person who calls us. We're very concerned about depression. It's important to be able to identify the signs of depression. People who are suicidal, we're very concerned that if there's any types of talk or thoughts of that person gets help immediatly. In Ocean County, we see bullying. We see bullying everywhere, and we're certainly trying to address bullying. We know the devastating effects of that bullying has on children. Also in Ocean County, with the high amounts of seniors, a lot of them are alone. A lot are lonely. We know there's programs. We know caregivers can go into houses. We know that Senior Services offers a lot of programs for people. We know that Ocean County College and Georgia Court offer programs for seniors to get people involved. We have wonderful senior centers in Ocean County. We have Meals on Wheels for people who can't, they probably can't afford to get a meal, but they will be getting a hot meal each day. But mental health is very important. We don't like to see people alone. We know that people who are alone and lonely, especially adults, are more at risk for drug and alcohol abuse. So we certainly try to address that. We have, Ocean County Health Department is home to the municipal alliances that each municipality, most of the municipalities in Ocean County have a municipal alliance. And what they do is they develop prevention programs, only prevention against tobacco, alcohol, and drug abuse.